right, hi everyone, good afternoon. All right, thank you so much for joining us for our session on redesigning the future of our healthcare system. My name is Elizabeth Tapia, and I'm the CHCI DeVita Health Graduate Fellow. The importance of increasing healthcare technologies, especially for Latino communities, cannot be understated. Given the many barriers to physically accessing healthcare services, developing life-saving technologies and expanding telehealth services will only work to reduce these health disparities for marginalized communities. On behalf of CHCI, I'd like to thank 3M and Amazon for their generous support of this session. According to The Economist, the digital revolution in healthcare is speeding up, and investment into digital healthcare has soared. Telemedicine, predictive diagnostics, wearable sensors, and a host of new apps will transform how people manage their health. But how can we ensure that Latinos are recipients of equitable access to our nation's healthcare technology and are represented in the STEM workforce? Today, we will hear from a panel of distinguished experts on the advancements in healthcare technology and how tech-enabled Latino communities can help change the future of care. Before we begin our session, it is an absolute honor to introduce our session chair, Congressman Raul Ruiz, who proudly represents California's 36th Congressional District. After graduating from Coachella Valley High School, Dr. Ruiz graduated magna cum laude from UCLA. He earned his medical degree, as well as a Master's of Public Policy from the Kennedy School of Government and a Master's of Public Health from the School of Public Health from Harvard University, becoming the first Latino to earn 3 degrees from Harvard University. Dr. Ruiz completed his residency in emergency medicine at the University of Pittsburgh and continued his work as an emergency room doctor until he was elected to the House of Representatives in 2012. As Congressman Ruiz, he continues to fight to protect Medicare and Social Security benefits and works to find bipartisan solutions that will improve our nation's healthcare system. He currently serves on the House Energy and Commerce Committee, the House Veterans Affairs Committee, and serves as chair of the Congressional Hispanic Caucus. Please welcome Congressman Raul Ruiz.
Thank you, Elizabeth. Hello, everybody. How are you? Good. You guys pumped up? This is exciting information. I sit on the telecom subcommittee on energy and commerce, so this is right up my alley. I'm Congressman Dr. Raul Ruiz. I'm an emergency medicine physician, a public health expert, and I'm also the chair of the Congressional Hispanic Caucus. And it's a pleasure to join all of you today for CHCI's Tech Summit panel on redesigning the future of our healthcare. So I want to thank CHCI and all the organizers and the staff and everybody that put your heart and soul into this event, all the sponsors as well, and especially our esteemed guests. We have Dr. Melissa Clark, Dr. Abdul Shaikh, and Guadalupe Hayes Mota, and the moderator, Dr. Isaac Rodriguez Chavez. They're going to have a very stimulating and intriguing conversation that will be helpful and plant a seed in your minds in the future and policy of what we're going to do for healthcare and technology and the intersection of that. Look, the reason why I care a lot about healthcare is because I grew up in a trailer park in a poor farm worker community in the city of Coachella, California. My parents worked in the fields. My mother worked out in the fields. My dad was a mechanic. They met, got married. When my dad was promoted to work at a packing house, we moved into our home in Coachella where my mother still lives. So ever since I was a young boy, I wanted to be a doctor and fight for health and social justice and make right the wrongs and relieve pain and suffering that many of our communities and family members who struggle day in and day out go through. And so I made that my life mission. I went to CV, UCLA, Harvard Med, Harvard Kennedy School of Government, Harvard School of Public Health, did my emergency medicine training at the University of Pittsburgh, did a fellowship in international emergency medicine, humanitarian disaster aid, and went back home to the Coachella Valley to serve the community as an emergency physician, never in my wildest dream thinking that I would ever run for office. It was always to be a doctor and go home. But when you're working in the community and health and social justice is your mission, it's a natural extension as a physician to address the social determinants of health, the public health disparities, the lack of equity, and to make sure that we tackle the bigger systemic barriers that exist in order to give everybody equal opportunities to live the most fruitful life that they deserve. So for me, healthcare for the future means addressing several issues. It also means using our technology, addressing long COVID, boosting telehealth, and using technology to help already successful programs on the ground. One of the disparities we've seen in Hispanics carrying a disproportionate burden of infections, hospitalizations, and deaths from COVID-19. In fact, Latino population is more likely to struggle with the effects of long COVID than other populations. They are more than twice as likely to die from COVID-19 than white Americans. A high percentage of Latino families have already experienced job loss due to long COVID, and others live with the stress and anxiety that they are going to be laid off because of missed work due to their lingering symptoms. When we think of healthcare for the future, we must think of healthcare that considers the impacts of these long COVID and the external factors that prevent an individual from moving forward, like lack of paid sick leave, high childcare costs, and schools not ready for impacted children, lack of health insurance. And second, when we think about redesigning the future of healthcare, we can't forget the growing trend of telehealth and its ability to increase access to quality healthcare for rural and underserved patients. And telehealth is now standard in many practices thanks to efficiency and lowering costs, yet widespread adoption has been slow. And we need some policies to help fix that. Our very own CHC member, Senator Cortez Mastos, woohoo, she helped us win the Senate, okay, introduced a Telehealth Extension and Evaluation Act to expand and modify coverage of telehealth services under Medicare until 2 years after the end of the COVID-19 public health emergency. And then the third thing is that leaders in technology should also look to successful on-the-ground programs like community health workers or our promotoras in our community, and think about ways to help advance their work and empower them. The future medicine is going to be a combination of what I call tech medicine, the phone, digital apps, telehealth, or tech health through apps where you can consult with your physician, where you can have mental health counseling and therapy through video apps, through routine checkups by community health workers that comes to your door, sets you up, and really increasing the social networks that we need to stay together as a community, because community cohesiveness is a social determinant of health, and your social networks in those communities is a social determinant of health. And so this is how we can stay connected and move forward. So the combination of telehealth, tech medicine, and doing home care, community care with our promotoras on the ground is a good way to relieve disparities. It is shown to work during the pandemic in getting our information, our tests, and our vaccines into the communities, into our hardest reach, most vulnerable areas. And so we need to not just restructure the payment system, but the whole healthcare delivery that puts equity and health disparities in our communities in the forefront. So with that, I want to thank everybody for being here, and I got to run, but this is an incredible opportunity to listen to incredible speakers who are very knowledgeable about this topic. Doctor? Thank you.
All right, thank you so much, Congressman Ruiz. It is now my pleasure to introduce today's distinguished moderator, Dr. Isaac Rodriguez Chavez. He is a biomedical leader with expertise in infectious disease, viral immunology, viral oncology, and vaccinology. Currently, he is a senior vice president, scientific and clinical affairs, and head of the Center for DCTs and Digital Medicine at ICON PLC. He has held previous leadership positions at the FDA Center for Drug Evaluation and research senior official for clinical research, regulatory compliance, and policy development to modernize clinical research through decentralized clinical trials, digital health technologies, and real-world evidence. He has authored numerous articles and is an advocate and leader in the field regarding equity, diversity, and inclusion, especially in clinical research, healthcare, and technology use. Please welcome our moderator, Dr. Isaac Rodriguez Chavez.
Thank you so very much, Elizabeth, for this warm introduction. I wanted to welcome all of you to this session and my dear colleagues and panelists who are here with me. I wanted to thank, first of all, and most of all, Congressman Ruiz, Dr. Ruiz, Raul Ruiz, for the opportunity to be here with all of you today and share information that is important to all of us in relation to the healthcare, redesigning the future of our healthcare system and how technology is making a transformative changes in what we nowadays know as healthcare and medicine and even clinical research. So I am going to introduce our dear panelists, and in the first panelist that we have is Dr. Melissa Clark. She is the Chief Population Health Officer for Healthcare Transformation and Health Equity at 3M. Melissa?
I am very delighted to be here today. Thank you to the Congressional Hispanic Caucus for inviting me. I just wanted to say it was just so inspiring to hear Representative Dr. Ruiz as an emergency physician, because that's what my background is too. And similar motivations, watching people, fall through the cracks of the healthcare system in the emergency department is really what inspired me to focus on health disparities when I entered medicine. But now the focus is on health equity, which is much more solution-driven. And so talking about technology and how it can be a part of that solution is really what I hope we'll cover today. I'm looking forward to the discussion.
Thank you, Melissa. And next we have Dr. Abdul Sheikh, who is the Principal for Population Health Analytics at AWS, Worldwide Public Sector Healthcare.
Thank you very much. I'm also very, very pleased and honored to be here. And I think, like all of us, just very inspired by Dr. Ruiz and his opening comments. I myself grew up in public housing, and I look at where I am today, and it really is because of the help of others, individuals and organizations. And I think that's what we want to talk about today. I just want to mention one thing that I think is relevant. One of the hats I've worn is the co-chair for the National Advisory Group on Diversity, Equity, and Inclusion for Academy Health. This is a clinical health services professional network. And one of the members of the advisory committee was Dr. Eduardo Sanchez. Some of you might know him. He's the Chief Medical Officer for Prevention for the American Heart Association. AHA, he was involved with co-authoring a presidential advisory report last year. And it talked about the need to really address the social determinants for healthcare and for our health outcomes. And I think one thing really struck me is the way that he talked about for our advisory group this importance of individuals and institutions. So I urge you to look up that report, AHA Presidential Advisory, and I look forward to the conversation with my
Thank you, Abdul. And next we have our panelist. Our next panelist is Guadalupe Hayes Mota, who is the Chief Executive Officer at Health Solutions and Mid-Career, and he's a mid-career MPA candidate at Harvard University.
Well, thank you for that. Healer Solutions was actually developed for the premise of kind of giving equity and be able to provide medicines to patients that don't have access, and so to speed up that process. And it comes personally to me specifically. I was born and raised in Mexico, and I didn't have much treatment access as a hemophiliac, and that really impacted my life. And so we developed this company to really be able to provide these medicines to patients around the world that don't have it. And I think having this conversation about that equity and the ability for patients to get this is really important for our communities. So I'm really, really happy to be part of this conversation.
Fantastic. Again, welcome all of you to this session of discussions on a topic that is very important for all of us. And clearly, I need to emphasize our grateful appreciation to CHCI for hosting this session and for hosting the Tech Summit and bringing the Latino community together around these important issues. So this is really, really relevant, and we are most grateful for the opportunity that is given to all of us. All right, so we are ready to warm up and have the way that this session is organized is we're going to have some questions in relation to the past and the present of the healthcare system and connection with technology, evidently. And then we're going to move on to the future and what the vision is for the future. Needless to say that digital acceleration, digital health technologies are changing the standard healthcare system. And the question here is how? And how are we going to see in the years to come all those transformative changes playing into our lives? That is an important topic. However, we know that many actions and many things connected to technology and the embracing of the Latino population is rather limited, because not only that we are a minority, but there is minorities of minorities, and only 6% of Latinos are engaged in STEM and careers related to science and medicine. So how do we change that paradigm? That is something that we will be addressing here. And so we will be discussing, excuse me, connections and advancements related to the healthcare technology and how the tech-enabled Latino communities can help change the future of care. And I have one more to you. Healthcare is going to be connected more and more with the clinical research, as we will discuss. So past and present, dear panelists, and the first question is, excuse me, can you all, let's do a round robin, a brief round robin to see if we can cover many of the topics that we need to cover. And the idea is to complement each other's comments on the topic. Can you speak about the technology development ways, the technology development and the ways that work we are doing improves the healthcare system in regards to technological innovations? I will start with you, Melissa.
Sure. So I work for 3M, over 100,000 employees worldwide, 4 different business groups. Many of you might know us for our masks, for example. But we're constantly innovating. And actually the saying is you're never more than 10 feet from a 3M product. So masks are in our safety division, for example. Post-it notes and Scotch tape in our consumer goods division or business group. And then our transportation and electronics division, one thing that's very visible, street signs, the reflective coating. And then I'm in the healthcare business group. And within there we have divisions, for example, oral care, lots of innovation around the design of dental and orthodontic products, as well as infection control. Our medical solutions division. So unfortunately, I had to have a surgery 2 years ago, and I was amazed looking through the eyes of a 3M employee at all the products that were in the hospital, even from the IV tape that was used to secure my IV to the bear hugger machine that kept me warm and regulated my body temperature while I was in surgery, all made by 3M. And so everything around infection control as well as wound care is in that medical division. And then I'm in the health information systems division. So one of the great innovations currently right now is using ambient AI to be able to pick up the conversations and record and document the conversations when doctors talk to patients, which actually creates time for that doctor to be more engaged and more interactive rather than having to document at the computer while they're talking with you. And then data analytics and our methodologies, which really undergird the payment system and the way that resources get allocated in the healthcare system with an eye to quality and making sure that quality is recognized and paid accordingly in the healthcare system. That's all done with our 3M data analytics and methodologies as well.
That is a tangible example of really how technology is transforming and changing the healthcare system, and your experience and as well as what you're doing in your work is really impressive. Next.
So for us in Healer Solutions, like I said, that what we established ourselves to be was to really just be able to accelerate the drug process. And we're trying to create innovative technology to do this. What we are doing we do it in two different ways. And one way where we are doing it is really kind of investing in AI machine learning to really kind of increase that speed as where we are developing these drugs, but also with having a health equity lens to it. What that means, utilizing some of that data that we have for individuals that haven't been used previously to really kind of feed into the system so we can predict better medicines that will be used for people that are not being considered before. So that's a really important thing that we'll look through that lens of health equity in that regards. And then the other side, we're trying to develop technologies to really accelerate the production and the manufacturing of these products. And the way we're trying to do this, really connecting the system. In order for us, when doing this increased acceleration, we're able to decrease the cost of productions and hopefully impact the price of the product that we deliver to the patient. So these things are really seen through the lens of providing medicines to certain countries that wouldn't have otherwise. So it's really what drives us and makes us who we are, and our values is really health equity and be able to provide to patients that don't have it.
Bill?
Thank you, Isaac. So I'm with Amazon Web Services. You might know we're the cloud computing arm of Amazon. And Amazon was technically the first customer for Amazon Web Services, because if you can, think about our warehouses, our products, our consumer goods, all the supply chain and the data around that complex global infrastructure, the cloud allows Amazon, but also our customers that are governments, agencies, industries, nonprofits, to really look at how they can better leverage that information. And in healthcare, our mission is to drive the quintuple aim, right? And how do we help our customers really leverage the data for better quality, for care, for patient-centered care, for better outcomes, but also really for health equity, right? And I think that's really exciting for us. And I'm going to talk a little bit more as our panel goes on around some of the programs we have around education, around startups, around really how to drive innovation that is purposive. But it ties back to our principles. Our principles start with customer obsession. In this case, our customer, would be the community. Minority health is important. The Latino community in America is a part of the fabric of this country. But as serving customers, we need to think about what are their needs in all the uses we provide for helping them leverage their data. And I think the other leadership principle I just want to highlight is around how we recognize our success and scale really bring responsibility for us as AWS and Amazon to be able to do right by our people, our community, and the world.
Indeed, I couldn't agree more with you. And my connection with all of you and what we have been discussing today in the standard healthcare system and technology is, in my case, I work in ICON PLC, which is one of the largest clinical research organizations in the world, and I am leading the modernization of clinical research. In the clinical research space, modernization means decreasing the burden of the patients to allow participation, embrace equity, diversity, and inclusion, use technology to lower the burden, among many other things, and leveraging with the standard healthcare system. All of these trials are happening now as we speak. And the idea really is to deploy these trials in the communities where people live. That means that the healthcare system needs to be in connectivity with clinical research. And so the two is a trend that the unification is to happen, and something that historically wasn't there. The standard healthcare system has been working in parallel and in silo compared to clinical research. But as we go on in life, I think we find situations in which the standard healthcare system may or may not provide the specific medications that we need. And in situations like that, in many instances which are life or threat, we need to go into clinical studies and test and be part of experimental medications that are being tested in clinical trials. So the healthcare system and the innovations connected in the healthcare system are embracing multiple opportunities for all of us to take advantage of. As Latinos, minority populations, embracing equity, diversity, and inclusion, and getting into technology, getting into clinical research, and utilizing technology in multiple aspects, as my colleagues are presenting here. So speaking of equity, diversity, and inclusion, and I'm going to now go from Abdul and continue with Guadalupe and Melissa. Let's talk about what is the impact of this technology innovation in the standard healthcare system in relation to communities of color?
Mm-hmm. Great question. How long do we have here? I want to riff on what Dr. Ruiz said when opening, right? Because he described this vision, which is compelling. And it is something which many people in healthcare and technology and innovation are talking about, right? How do you connect information from the clinic, right, to the community, to individuals, to providers such as Promotora, community health workers as well. And there's data behind all of those interactions, right? And I think when I think about equity and innovation for a community, including communities such as minorities, Latino communities, let's think about a few of the challenges and opportunities which we're aware of, right? So one is around how you have these devices, you have wearables, but are they being developed in a way that can really account for the needs of our communities, right? Like the Latino community. You know, we've seen some of the challenges around sensors and how they could have inaccurate measurement of skin color, right? Like if you have that watch that tracks your heart rate, going for a jog, it may not be able to do that well depending on the color of your skin. Similarly, we're all, I think, recognizing challenges around data and analytics and the use of algorithms, for example, and biases in AI. And so what I've been excited about is some of the things that we're doing. I'll mention one because Javier's here in the third row, but we've been working with the National Health IT Collaborative for the Underserved, and we helped them develop a data fusion center, which is really a platform for bringing in de-identified data around determinants of health. So around income and healthy community access and access to food. And that data is made available for others to use. I believe there's a group of researchers that are using it to look at how can that data be combined with data from your clinical record, for example, to provide better care for minority communities and minority health. So I think that's one example of where there's opportunities. And it starts with really getting you all engaged in this health innovation enterprise.
Guadalupe?
Yeah, so for us, what we kind of focus, I go back to, is that drug development kind of phase to it and discovery. And a lot of what has been done in the past with a lot of drug discovery has been very limited and has been very put into a very specific population that does not include a lot of diversity. And so what we are trying to do when we are creating these systems with machine learning and AI is really incorporating this data that we have coming from Latinos and coming from these minority groups to really kind of rechange how we're looking at this and create better outcomes, right? And creating better medicines that will be better effective for this population that incorporates this. So for us, that's one of the most important things that we're trying to incorporate that data to really make sure the products that we're creating represents the populations that it's trying to serve. Because in the past, a lot of these drugs have not, so it is important for us to really incorporate that into our technology development. And so we really kind of push that forward, and is why we want to give that health equity, again, lens to it, to make sure we are producing medicines that are effective for everyone, right? As it includes everyone, and that is Latino populations.
Thank you. Melissa?
Sure. So as I mentioned at 3M, we have innovation across the country, across the company. So I wanted to first start with our medical solutions division, and Representative Dr. Ruiz mentioned telehealth. So, and I also mentioned that medical solutions division focuses on wound care and has innovative technologies that help to heal and close wounds up. And as we know, wounds occur in diabetes patients. And of course, diabetes is disproportionately affecting Black, Latino, and Indigenous communities. And so in order to help close some of the gaps, they've started a remote patient monitoring that uses telehealth to be able to reach out to individuals that are using that wound vac machine to help them remove any barriers to using it and make it that much more effective and have better results in terms of wound healing. And then in my division, health information systems. One of my passions is what Abdul mentioned, which is how do you get an understanding in a population of what the health disparities are, what are some of the root causes of them, and how prevalent they are, so that you can start to design interventions to be able to close those gaps. So again, using our methodologies, which give you an understanding of how well or how sick people are in your population, and put them into groups where it's clear how sick they are. You can then use race data, ethnicity data, other social determinants of health factors to drill down and see how are these populations faring, and then when you design an intervention to try to address what's going on, how you can actually see, is that intervention effective? Is it actually closing the gap in care that you really want to focus on? So we work with payers, we work with health systems, we work with providers to use their data to be able to try to answer those questions.
I'm just going to chime in here because I'm excited. And I think that one thing we talk about a lot in disparities research, I know I have, is the deficits, right? Like there's greater risk for the Latino community, lower household income on average, or education levels, high school attainment. But there's also resilience and protective factors.
Yes,
right?
absolutely.
Like greater social support in certain communities and subgroups, greater resilience around diets from communities from back home versus here in the US and acculturation. So I say that because these interventions, we also really want them to focus on the strengths in the Latino community, for example, right? And how do you bring that out and not just addressing deficits?
And I think a perfect example of that is how the faith-based community in both the Latino community and the African American community rallied around messaging around COVID vaccination. And actually what we've seen is that the rates of vaccination in both those groups have now actually equal or surpassed that in the white population. And a lot of that has to do with resilience and using the structures that are in our communities to be able to best message and help people understand and overcome their fears and concerns.
And so agree with all that have been said. I guess the point will be to mention or to call on all of you participants to be part of the STEM and to be part of that innovative technology wave that is embracing all of us, to be part of the standard healthcare system, to work in the innovation of the technology that is necessary. Congressman Dr. Ruiz mentioned telehealth and talked about the future, about the technologies and all of that. So the word that I give it to that, and I agree with him, is technology ecosystems. And so there is a customized technology that needs to be put in place for the standard healthcare system that has to be interoperable, has to be multifunctional, has to be integrative of clinical data, the clinical data that support and that represents each one of us. And that is regardless of the race and ethnicity or any other parameter, social parameter that can be addressed. So technology is here to stay and is something that is of high level of importance. And that is a segue for me to ask the next question, which is, knowing that we need all of you in this room and in the building and in the United States and in the world, we need people working, colleagues working in technology and getting to work in the standard healthcare systems and in the things that I am doing, clinical research as well. So what opportunities are available for youth to enter the STEM fields? Melissa?
Sure.
I know that you're eager to talk about this, so let's go.
All right. So prior to coming to 3M, I was actually assistant dean of, a couple jobs back, assistant dean of medical education at Howard University College of Medicine, which is a HBCU right here in DC. And one of the programs that I administered was called the HCOP program, Health Careers Opportunities Program, which was actually a federally funded program that created opportunities starting with elementary school all the way through college to really draw people into healthcare professions, dentistry, nursing, medicine, physical therapy, all down the line. And there were summer programs, career opportunity programs that were a part of that program. So if anyone has interest in that, I would say Google HCOP program near me, because they're also all the way up to entry to medical and dental school. There are resources and experiences that will help guide your career. And then at 3M, we're very focused on our summer internship programs. So individuals who have an interest in a STEM career, anything from engineering, biomedical, computer science, and then even business development, marketing, finance down the line. We have internship programs, and we have partnerships with both HBCUs as well as Hispanic serving institutions to help recruit individuals to come to those summer programs. So again, would encourage you also to look that up as well.
Guadalupe.
Yeah, I think this topic itself is something that I take very personal. I'm very passionate about. I'm an instructor at MIT where I teach biotechnology, and I feel there, and also with the work that I do, trying to hire new engineers, new data scientists in these components, there is a dry pipeline coming in that is not really with a lot of diversity. And there's a lot of Latinos are not being represented at these spaces. And so I urge and always trying to advocate to really bring people through the pipeline, through these different things, starting from middle school to high school and into college, that really connects what is STEM, right? And it really connects individuals to what you're doing with this work. And an important part of that is trying to connect mentors with specifically students, right? And having that connection. So you can see yourself being part of that. Because when I'm an engineer by training, right? When I started to do engineering, I didn't see other engineers that were Latino. I didn't see that ability to do that and reflect myself in it. But the ability to, having mentors, and that's the most important part to bring people up. So what we're doing with Healer Solution is trying to partner with different universities such as MIT and Harvard to bring students in and really create that mentorship and trying to give the ability to the students to really get exposure to what STEM means. And we need this abilities and the skills because it reflects what exactly the technologies we do, because technologies are only as good as what people are making them. So if you have a diverse group making this, you're gonna have a diverse technology. An example like this, like in biotechnology, if you're not representing this in the medicines you are doing, then it will not have a comprehensive outlook. So it's quite critical that a lot of Latinos will be bring up to the STEM, so there needs to be more representation in that.
Abdul?
Yeah, I just want to double click on Guadalupe, what you're sharing. And I think for us at AWS, I'm pretty excited because we have this initiative that's not a new initiative. It's 29 million by 2025, 29 million. And it's really meant to be a target for us to drive training and skills in cloud and cloud computing. So it's data, it's analytics writ large. Like we have over 500 free courses and multiple certifications. And so there's a pathway here where we even offer called AWS Restart. It's a program in 23 cities in the US, but also globally. And it's for individuals who have at least a GED or high school level education. And it allows them to look at reskilling for cloud computing, for really grounding yourself in skills that are necessary for using technology, for using data and innovation. And I think those two programs are just two examples. But what's really cool, I think, too, is you have many very talented community members throughout the US and the world who don't have formal education or training, but they have ideas, right? They have ideas around starting up, and they may be self-taught in terms of coding, in terms of analytics and information. And so we even have a program, we just wrapped up the first phase of a health equity accelerator. And this is a program where we actually had people that had startups that had early stage ideas around how to use data and how to innovate it for health and equity. Specifically, one of the leaders in this effort has been Zocalo Health. So Zocalo Health, if you Google them, it was founded by Eric Cardenas and Maritza Hardin. I love what they're doing because they have a platform, and they went through this accelerator where we provided them with training and support, but also mentorship, really, right? And their platform allows for virtual care for families in the Latino community specifically, and it ties them to primary care with culturally competent services, but also to a growing network of promotores. And so it really is that idea of a connected clinical and community health system, and they have a platform that allows you to really drive that support. So that's just one example, but I think there are so many opportunities here, and I think, like you said, it's up to you all to really, after this session, reach out to us and go on the web and look at how in your own networks you can help elevate the opportunities to learn.
So in the interest of time, I'm going to open this session for questions from all of you. Clearly, there are many more questions that we haven't covered, but we want to hear from all of you. So while you warm up like we did, and the microphone is available, please ask your questions. We're here to answer any questions that you have. We are talking about the STEM and the opportunities that exist for all individuals to join and to participate. We are talking about the diversity of organizations and opportunities that exist to join careers in connection with the healthcare system. And that can be not only medicine and scientific careers, engineers careers is an example, and many other areas of the professional endeavors can actually participate in the standard healthcare system. And guess what? There is room for everybody. That is the beauty of this. The richness and the diversity of the healthcare system actually allows for improvements. And so the richer, the more diverse in professions and in cultures and races and ethnicity, the better off we are, because we bring to the table experiences from multiple angles. So that is really important. So I truly want to encourage all of you and some of you to get on the microphone and ask us questions while we are here. There is one question, anybody? Yes.
Hi, thank you all so much for everything that you shared. My name is Madeline, and my question is, so you all touched a little bit on like the education and what your companies are doing, but as Guadalupe said, technology is only as good as it's made. So what is 3M, AWS, and Healer doing to make sure that diverse groups and Black and brown people are being put in executive positions?
Great question. So diversity, equity, and inclusion is really sort of a core value at 3M. And it's because I think many companies are realizing that the more diverse people that are at the table, the better it represents and helps them understand their customers, suppliers, et cetera. And so it gives them a competitive edge. And so 3M's goal is to really increase representatives from Black and brown communities, double the representation is now, which is I think 8%, to increase it to 16%. One of the ways they're doing that is partnering, as I mentioned, with HBCUs and HSIs to be able to really better recruit a diverse workforce. And then once you get to a company, it's not enough just to recruit. You have to have an environment that's nurturing, that recognizes the value of diversity and celebrates it. So we have employee resource networks that help to do that. There's also a goal which has been met for 100% pay equity across the board. So I think that's really important. And then there was recently a $50 million investment around health equity, and the way the decisions were made about the 5 areas to invest in was by getting the voices of the diverse employees to help to decide how to make those, make those investments. And I'm going to read them because I didn't want to take the chance to not memorize them. STEM, equity, access to healthcare, transportation, safety, education, and housing were the 5 areas in which that $50 million was invested. And ongoing investments exist. So I think, again, when you're looking at a company to work for, it's not just a matter of getting recruited, but what is the infrastructure in place to make sure that you have a seat at the table and you're adequately represented.
Any other comment on the question?
I'm happy to talk, and much of this is online in terms of our leadership principles. But we also internally, we have affinity groups and we have diversity, equity, inclusion ambassadors. And I think you mentioned it because you said, how do you really help elevate minority representation in the leadership, right? And not just across the general firm. And I think that idea of having our leaders really step up, be able to make that commitment to the team member, to the organization. We have 2 million people plus worldwide at Amazon. And what's really good is you see our leaders actually stepping up, and you have affinity groups that are driving a real recognition of how it is an imperative. And the business case is there. You look at, the MBA peer review literature, right? And it's all there. More diversity equals better innovation, more meaningful service. And that aligns with our obsession on customers and addressing their needs. I'll also mention that we have this Health Equity Initiative Fund. It's $40 million for 3 years. And it's a way to be able to drive new types of innovation with credits for using Amazon Cloud, Amazon Web Services and our cloud, for greater access, for addressing social determinants, and for driving more equity. So there's multiple programs, and I'm happy to talk about them afterwards when we wrap up.
For us at Healer Solution, we were established, I'm a co-founder with other co-founders in business school, and we're all people of color, so we came together to really establish this company, because I could go back saying our values are about health equity and providing care for people that need it, right? And so given that, we have created an environment where we really think about how do we develop the next generation of individuals that don't have representation in engineering, in leadership, in STEM. And that's pretty much how we kind of cater our entire environment. Mentorship is really important to us because we're able to kind of mentor the next generation of being able to do the kind of STEM work. Because like I said, when I was an engineer myself, I didn't see much representation. I didn't connect much with other people, but we are trying to change that. And we're doing that because we establish our leadership. So we are all people of color that we're doing this together.
And I would add to your question, in ICON PLC, we have what we call an ambition committee that is addressing every single item connected to equity, diversity, and inclusion, our philosophy, our retention of personnel that is of color, and many other parameters that are really in active need of addressing the existing disparities in the societies. We have another question, and while we have the other question, let me just add, the STEM programs exist in multiple organizations, fellowships, experiences, summertime experiences in multiple organizations exist. If you are interested in a university, as Melissa mentioned, if you're interested in a company, visit their websites, and many of them will have information in regards to opportunities to do an internship or to work part-time or to engage on programs connected to the fields that you want to work in, and is connected to equity, diversity, and inclusion as well. So take a look at the places where you would like to be. That is the take-home message. Question over there.
Great. Good afternoon. My name is Rosemary Garza, and I work for Televisa Univision, which is one of the largest Spanish language networks in the United States. My question to you has to do with the outreach that you're doing to the Latino community. One of the barriers, right, is that they don't speak English, right? So, if we're trying to reach, the growing Latino community in the U.S., whether it's via, masks through 3M, or ensuring that they are enrolling in clinical trials, which are incredibly important, right, for our community, or even just learning about the services that AWS has, what specifically resources are you devoting to ensure that the Spanish language community has access, right, to these services? And it's a bit challenging, right, when they don't speak the language and you want them to, and I'm gonna pick on the biotechnology company because I think it's a great example. I think those clinical trials are incredibly important as we are trying to identify, diagnose, and treat people with chronic conditions. And as you guys know, each community varies, right, in terms of how they respond to treatment. So I'm just curious, like, how you are working with the Spanish language community to ensure that they also are aware of your products, therapies, and services.
Thank you for raising that question. That is a very important question indeed. And so since we are talking about technology innovation and the healthcare system, I will put the spin to your question as to how do we address the gap that exists in language barriers and adding that to the technology and the healthcare system. I will let you all chime in.
No.
Go ahead.
No, go ahead.
A couple of examples. One is, in terms of how we at AWS are helping our customers really leverage the value of data, including data that is in the Spanish language. Our NLP, which is our natural language processing technologies, they're not just available for English language data or information. Like, for example, when your nurse or provider enters in, text about how your health is, and if that is a Spanish language provider, be it in Europe or Latin America, our systems can actually automatically read that Spanish language information and then codify it and standardize it so then it becomes standardized data that can be used. So that's just one example where there's a lot of activity and a lot of focus on exactly what you're saying, which is how can the technology help be a driver that's culturally competent in the native language, in this case, Spanish-speaking people. And then another example is around, I forgot, I got so excited about the first example, but if I remember, I'm gonna come back to it and mention it.
So the gap exists, and that is a reality. The language barrier is tangible, and the digital health divide equally exists. And so it's a process, and there are multi-pronged approaches that can actually be implemented. Embracing the language, the local language. When it comes to, for example, and I deal with clinical trials, embracing the standard healthcare system. So in our case, if we are conducting a trial at the global level, global scale, we need to make sure, in agreement with the sponsor of the trial, that there is consideration for local languages, for international languages, so that we can embrace not only the Hispanic community, but any other community and the language of that community, because we have to be meaningful so that we can enroll and retain patients in clinical research and refer them to the standard healthcare system. By the same token, we need to increase the masses of individuals of minority communities who are engaged in technology innovation, who are taking STEM careers, because the digital divide continues as we don't have the population that is able to implement those innovative technologies and give access to people regardless of race, regardless of ethnicity, so that they can actually become proficient in the utilization of technologies and access to internet. That is actually an ethical, from the medical standpoint, is an ethical issue, and it can even become a legal issue. There cannot be discrimination because of not accessing technology or not having the knowledge to deal with a wearable device. That is an important matter. Any other question, please, from the room? And so while you are thinking about your questions, and we have a few minutes to go, let's look at the future. What can we do to empower and motivate and to enable the Latino and other minority communities to benefit from and to drive the change and the leadership in technology innovation to improve the healthcare system? Thoughts on that, panelists?
So I know we're short on time, so I just want to make sure I get this out. I tell my niece, who's a sophomore at Howard, this all the time. Do not be afraid to reach out to people to ask for advice and mentorship. That is so key, because we've talked about the role of mentors, and I offer myself, and I'm sure the other folks on this panel, if you have any questions, feel free to reach out to us. And then anywhere in your chosen profession, make sure that you make those relationships, because relationships are just about everything. And so, don't hesitate when it comes to finding a mentor, cultivating those relationships, building your networks. All those things are very important as you go along your educational pathway.
Any other comment on the topic?
I just want to reiterate, I think mentorship is everything. I wouldn't be where I am without my mentors. And I think it's quite vital, and that's one of the most driver things that I do, is really how to connect Latinos with STEM and really be able to get them there. And I really believe that having that connection and seeing someone that actually looks like you, see that, you can see yourself getting there. And so it's quite really important to do that. And I volunteer myself to do that. So if anyone has a question, I'm more than happy to talk about it, because I think it's quite needed. I think there's a lot of Latinos are needed in STEM, and there's a quite need for it. And really trying to find individuals that might have that path and connect with them. And they're more likely to say yes, because there's so few of us, and be able to connect with you to bring the next generation of this is quite important.
So I wanted to thank you all, my dear panelists, colleagues, for your opinions and the information that you shared, your knowledge and the information that you shared today. I want to close this by saying the future, in my opinion, is bright. There are many opportunities. It needs research. We need to take active roles in what we do. There is mentorship, and mentorships of all types and in all fields. There is a need not only for diversity and inclusion in terms of the individuals forming part of organizations and making a transformative change in the innovation and in the utilization of technology ecosystems in the standard healthcare system. The future is bright because we are becoming more knowledgeable, because the opportunities will continue increasing in existence, because we will take charge and actions, and because there is a unification and expansion in the horizon, not only by utilizing the standard healthcare system, but also leveraging that with novel investigations in medicine. And that is an important aspect. But it really requires each one of us to be part of this. So I want to thank you, all of you, my panelists, Melissa, Guadalupe, and Abdul. And I want to thank you, all of you. And again, I want to thank the Congressman, Dr. Ruiz, and CHCI for the opportunity of being here today. And thank you to all of you.